We asked doctors on the COVID-19 frontline to share their experiences with us so that the people at large get a true idea of how life has changed for India's medical fraternity in more ways than it has for us.
Physician's work involves touching a patient, examining their eyes, palpating the abdomen, auscultating their chest, and the coronavirus crisis has made exactly this part of the doctor's work risky. I haven't heard a patient's chest in a month and a half since I've started seeing COVID patients. Adding to that, the use of stethoscopes has been prohibited as that might play a role in transmitting the virus between the patients.
COVID-19 pandemic is a challenge that will not stop after days, weeks or even months. It is here to stay till we get a cure or at least an effective vaccine against it. So we have to adapt and adapt fast to lead a clean and healthy and a safe lifestyle where strict hygiene and social distancing has to become a habit and perhaps the new normal.
How are hospital staff and medical workers dealing with the stress of new cases on a daily basis? How is it having an impact on their lives and families and colleagues?
Healthcare workers are primarily stressed with the fear that whether we will transmit the COVID-19 infection to our loved ones or to other patients if we are working in a COVID ward. After working in a COVID ward, it's always a tussle in the mind, should we go home or not? But with the experience of past 1 month, we feel that if all the protocols are followed meticulously and everybody works as a strong team, then probability of landing up in problem is very, very low. We will primarily attribute it to the extensive training imparted by SRV hospital in use of PPE, adequate numbers of PPE allocated to every individual, and also to the extensive training which SRV hospital has given, especially to all of the team members, especially to the housekeeping staff, and the sincere and meticulous efforts of housekeeping staff in giving us a pathogen-free environment.
We asked doctors if they felt the general public and society at large was giving them credit where it was due.
Taxing to keep fighting on both fronts, work and the personal front. Most of my resident doctors stay in hospital and are not gone home since 1 month. The only treatment that works, believe me, after treating hundreds of patients, I feel, is reassuring ourselves, social distancing and hand hygiene.
The COVID-19 frontline will remain rife with activity over the coming weeks. And if the last few days are to go by, there appears to be no quick end in sight for the crisis that we are facing. But within the confines of our homes and occasionally at our workplaces, if we are required to travel, our safety is by and large secured. But that can't be said of the men and women of India's medical fraternity who are putting their lives on the line to help us return eventually to the life that we were familiar with almost 2 months ago.